for the non-MAGI programs. Just some quick Affordable Care Act implementation facts, just to let everyone know that the Affordable Care Act, the Medicaid requirements were implemented October 1st, 2013. Additional functionality was implemented January 1st, 2014. And this was just the ability to accept medical applications via the e-pass system. Those 90,000 applications that you've heard Wayne and both Angela speak of that came from the federally facilitated marketplace, we turned that on, as well as all of those family and children's Medicaid applications started to be entered into NCFAS using a new streamlined application, which is also known as MAGI. NCFAS began conducting training on the MAGI application process in September 2013. And just a reminder to everyone, you've heard us say previously that open enrollment will start again on November 15, 2014. Just some key facts on the healthcare.gov applications. North Carolina has received about 99,000 applications between October 1st and August the 28th from healthcare.gov. The status of those applications, you'll see the information of applications that have been received, processed, and approved by North Carolina. What I would like to draw your attention to is those applications that have been submitted to healthcare.gov and have been approved as of the end of August of 2014, about 9% have been approved. With the untimely applications, this is something that we are quite proud of at this point. At a peak in time, there were about 104,000 applications, and this was the beginning of June 2014. We've worked out and cleared the backlog by about 81%, reduced those number of untimely pending applications by about 84,000. And I would like to note that there are about 58% of those applications that came through from healthcare.gov and were related to the Affordable Care Act changes. With the pending applications, as of August the 27th, we are down to around 20,042 pending applications. Our goal statewide is to have those applications pending down to 3,000. This is the average pending applications that were in the EIS system, and this is applications that were pending beyond the timely standard. And just some highlights of the application types that we have that are pending. There are those federally facilitated applications, around 6,600. The MAGI applications, around 4,800. The traditional applications, around 4,700. And the EIS applications, around 3,700. And you will also notice the peak volume of applications and how the counties have continued to work those backlogs. This was accomplished, as Wayne said, with us making contact with the counties, us working closely with those counties, having the counties to develop the accelerated Medicaid processing plan. We've also worked with counties on best practices and continue to work with counties on making certain that we can streamline those applications that are pending down to the 3,000 normal pending applications. And this is just the Medicaid recertification workload, just a burn down of the recertifications. The goal of the state is to clear the Medicaid recertifications by December the 31st. As of August the 27th, there were a total of 527,000 Medicaid recertifications that are pending through the end of the calendar year. We're starting to shift our focus towards Medicaid certifications as well as continue to focus on the Medicaid applications. We're working with the counties on sustainability, and sustainability will include the counties continuing to burn down those recertifications so that we may reach our December 31st timeline. Also, just wanted to draw your attention to the Medicaid error rate. As Wayne mentioned, the FNS error rate. With Medicaid, at this point, there are no error rates. North Carolina error rate was frozen by the Centers for Medicaid and Medicare Services during fiscal year 1994. As approved by CMS, North Carolina began conducting targeted Medicaid eligibility quality control reviewed pilots in 1995. And due to the ACA changes, Affordable Care changes, CMS is working with states to continue pilot reviews for the MEQC with the target position of the new rules in place by 2017. What we want to make certain everyone understand that successfully meeting the challenges is primarily a responsibility of the department as well as the counties. What we are encouraging the counties to do, as Wayne said, is to utilize the 75% enhanced match that they're receiving to reinvest, to get those resources that are necessary to complete the workload and help us to meet the goals.
Representative Burr, that concludes our presentation on NC-FAST. We're here to answer any questions there might be. Senator Corman.
Thank you, Mr. Chairman, and to Mr. Black and to Angela, I thank you for that report. And I have a couple of questions. First of all, last week, I read an article in a local newspaper that a particular department was saying that they could not operate and meet the requirements without using overtime. I've been also hearing from employees about the requirement for overtime and what it's doing to them. How is this impacting the retention of workers in the local DSS departments?
Senator Department, I'd like to refer that question to Wayne Black, please.
Okay, thank you, Senator Corman. Well, we have heard some reports of increase in staff on Family Medical Leave Act. We know there's been some turnover. I think some folks have retired because they didn't want to learn the new system. I think that's probably happened as well. What we are saying in county departments of social services, and we've had regular communication and will continue with the County Commissioners Association and county managers, and that is, while we're updating the out plans, you can't keep going as a regular plan to do overtime and comp time. You will pay the price. You have to look at your needs for resources. Again, this is where our operational support team will be there to work with counties to help them identify what are their resource needs. Some of our counties have done productivity studies and found that they needed positions. Go back to those numbers of increase in caseloads in the last 5 or 6 years, and that many counties, as you saw from the numbers, did not staff up to what they needed to be long before we started NC-FAST. So, yes, it is a concern, and we will be working one-on-one with counties, engaging the directors, working with the County Commissioners Association, boards of social services, and county managers.
Thank you. Follow up. Just sure, are there any outstanding deadline looming with us from USDA?
No, ma'am. We are continuing to report our numbers to USDA on a regular basis. We have communication with the Southeastern Regional Office. They're working with us. They appreciate that we've made great progress in North Carolina. But again, I want to be the first to say that we still have work to do, and we're going to continue to work with our counties to get to where, as I said, North Carolina is, we have a history of excelling in case processing, timeliness, and quality of work, and we plan to get there.
Thank you.
Senator Pate.
Thank you, Mr. Chair. I don't know exactly who to ask this question of, but there are a couple of references in the handout that we have in front of us that refers to refugee assistance. Could one of you give us some information about that? I'm afraid that's something I don't know that much about.
Ms. Bradshaw.
Yes, thank you for the question, Senator Page. Sherry Bradsher, Deputy Secretary for Human Services. We do operate a program called Refugee Assistance within the Department of Health and Human Services. It's been in operation for a number of years, ever since I've been part of the system, nearly 27 years. We have the responsibility when refugees relocate to the United States, and we are asked by the U.S. Department of Health and Human Services to help with their transition, that we do that, and we do that through employment and living supports into the community through nonprofit agencies. The refugees that come to North Carolina are predominantly from African countries and Asian countries.
Follow-up?
Yes, thank you, Ms. Bradsher. Can you tell me if we have any of these children who are apparently coming up from some of the South American countries, from what we hear, into the United States across some of the southern borders? Do we have any children that we're looking at after under this program in North Carolina?
Yes, sir. We do have what is referred to as unaccompanied minor children that are coming from the border. They are not considered refugees. They are not legally here and part of the program that we are referencing as refugee assistance in this particular presentation.
Madam Secretary?
Thank you, Mr. Chairman. Senator, the program on refugees, those are official refugees that have a specific definition by law by the federal government. So they're official immigrants through the Immigration Migration Office into the United States. They're refugees sometimes from war-torn countries that the world takes. They're distributed accordingly into the different countries, and the United States takes a certain percentage, and these refugees are distributed all through the United States. North Carolina, for many, many years, has a history of accepting the refugees, and there's an official federal/state program that works with this. This is something very different than our current issue that we face with the influx of unaccompanied minors coming in through our southern border. That's a very different issue, sir. So we do not mix those two either in the workload or the finances, or they're two different entities, sir.
Representative Dollar.
Thank you, Mr. Chairman. I want to ask about it looks like we've gotten a handle, or close to getting a handle, on all of the ACA applications through NC-FAST and the other methodologies that those have been processed. My question is, I'm making an assumption that when the open enrollment period begins again, we won't be looking at the potential for 99,000 applications. But I guess my question is, how many applications should we anticipate, or do you anticipate getting in with the open enrollment? Do you assume it's going to be lower, but have y'all looked at that, and have y'all looked at the processes by which we can move through those applications, hopefully more quickly, to determine who is and who isn't in Medicaid, particularly for budgeting purposes?
So Representative Dollar, I'll take that question. As I indicated before, we are working directly with our counties. We're going back and looking at the influx. The problem is there's no way to identify what we may or may not get in. And so what we've asked counties to do is look at the total number that we received last year. We're going to go back and look at those individually to see when those applications actually came in from October all the way through the end of March, so that they can kind of project worst scenario. We do not expect it to be the same volume, but they have to be able to plan for the staffing. One of the key things that I do want to share with the volume of information is that one of the key things is that while these counties have worked very hard to get down the ACA backlog, one of the key things to identify is that, you know, they had an influx of the 94,000 that they had to work to process, okay? Of those, about, traditionally before ACA, we had around 75,000. So we had about a 20,000 influx of additional work that impacted them. The key thing there is that the approval rate for those, as we were saying here, this 9% that actually went on, we actually, as we had fewer applications that actually received benefits, we had about 42,000 that actually received versus the 49,000 from prior years on average. So I think the key thing here is we're going to be working directly with counties between now and November for them to be able to plan for, and we want to plan for the worst scenario at this point, because there's no way for us to identify how many will be coming in. I think the other thing to understand is that there's probably a large volume of folks that decided not to apply because they were, you know, the penalty that they would receive. So I think the key thing now is you may see an influx of some of the younger folks that probably didn't apply, and now they're getting the penalty that they may want to go in and apply now to see. So we can't anticipate, but, you know, right now what we're trying to do is plan for worst scenario.
Mr. Chairman.